The burden of back pain. 80% of us will suffer some form of back pain throughout our lifetime, reports the National Institutes of Health. The pain can range from a dull, constant ache to a sudden, sharp pain. It can last a few days, months, or even years. Whatever the cause, one thing is clear: suffering with back pain can impact every area of your life.
Back pain affected many areas of my life. The major one, of course, is I couldn't really walk very far without severe pain. And I couldn't play the favorite game that I love to play, which is tennis. And it just took a period of time before the pain got so severe I had to do something.
While some patients get back pain relief through medications, more severe cases require surgery. Spinal fusion has been the standard surgical solution to acute pain caused by injuries, herniated discs, and other conditions causing spinal stenosis.
Spinal stenosis is a condition where, because of the arthritis in the spine, the tube that the nerves are in become compressed. Because of the nerve compression, the patient will experience pain in their back and their legs. Rigid spinal fusion surgery is a procedure that we use to stabilize the spine. What it does is it takes the spine, which is made up of several segments, and it takes a segment or a couple of segments, and it causes them to become non-mobile, so they no longer move independently anymore.
Spinal fusion surgery can alleviate chronic back pain, but it has its drawbacks. Patients never regain full mobility and may face post-surgical complications like stress on adjacent areas of the spine that can lead to further injury.
The drawbacks and the reason that we are passionately involved in trying to develop motion preservation techniques is the fact that if you fuse a single segment, that segment obviously no longer moves. That means that the segment above that and the segment below it now has to move, and maybe move a little more to compensate for the patient's ability to function. Because of that increased load at the adjacent segments, it can cause acceleration of degeneration of those segments, necessitating eventually further treatment.
Today, there is an emerging alternative to rigid spinal fusion surgery. It's called the Total Facet Arthroplasty System, or TFAS. In this breakthrough procedure, a device is implanted into the lumbar area to stabilize the joints after the removal of the bone or tissue causing the pain. Unlike with spinal fusion, patients may retain natural motion, and there is a shorter recovery period. Orthopedic surgeon Scott Webb has performed dozens of TFAS procedures, including the very first implantation in May 2005.
TFAS has been very successful at treating patients with spinal stenosis. With the TFAS, you allow motion to continue, so there is substantial theoretical benefits in that, because now you, by allowing motion, are not causing the stress at the adjacent levels, and then hopefully, because there's less stress at the adjacent levels, we'll see less adjacent level disease as time goes on. So the patients are doing extremely well after surgery.
The results after surgery were really quite phenomenal, I thought. I went in on a Wednesday, had surgery, and Thursday morning after the surgery I got up and I was able to stand up and walk with no pain whatsoever. So that was the main result. And from then on, I was free of any pain for, I mean, right up till now. I still am playing tennis 3 times a week. I mean, so I felt that it was a very wise thing to have the surgery.
I think TFAS will complement what we have to treat patients with spinal stenosis. Right now we only have a couple of alternatives surgically. We can do a laminectomy, we can do a laminectomy and a fusion. What the TFAS is going to bring to the industry is the ability to choose, so that when you operate on these patients, you can make the choice at the time of surgery whether they need a fusion or whether they would benefit from a motion-sparing device. So it may not replace fusion, but it will take the place of the fusion in many patients that we currently fuse.
With more clinical trials in progress, the Total Facet Arthroplasty System could be the medical breakthrough back pain sufferers have been hoping for. The Florida Spine Institute is breaking new ground in the treatment of back and neck pain. Located in Clearwater, Florida Spine Institute has become a destination for back pain sufferers seeking state-of-the-art treatment from a team of experienced medical specialists. From diagnostics to pain management to surgery to rehabilitation, Florida Spine Institute delivers solutions to meet the needs of any patient.
The mission of the Florida Spine Institute is to provide complete, compassionate, comprehensive spine care with some of the most innovative technologies that are available today.
The professionals at Florida Spine Institute take a thoughtful, caring approach to each patient. While others rush to surgery, FSI physicians evaluate each case individually and formulate a conservative treatment plan.
Several treatment plans need to be considered when you treat a patient. And so typically when we approach patients for spinal problems in patients with spinal stenosis, is we have a protocol that we go through. Early onset of symptoms, simple things, medications, therapy, maybe injections, and then ultimately if they fail conservative care, then surgical options apply. And there are multiple surgical options as well. By having multiple ways to address these problems, we're able to individualize the treatment plan so the patient has the best outcome.
I had had trouble for about 9 years. I've been to another spine institute out of state. When we moved here, I was told about Florida Spine Institute, so I came here and I came to see Dr. Webb, and as soon as he walked in the room, he had pinpointed my problem that no one had noticed for 9 years. I thought he was talking to the wrong patient. I was floored. Everyone in this whole office has just been dedicated to helping me get better. Each one of them have taken the time. The surgical coordinator, from the checkout lady to the doctor to the PAs, they all have been wonderful.
First of all, my wife has had 2 spinal operations prior to my operation, so I saw firsthand that Dr. Webb knew what he was doing. I had a lot of confidence in him. I liked his personality. He was very easy to work with. He never pushes me for anything. He doesn't want me to rush into surgery, but yet he knows it's the best thing for me. So I just felt comfortable with him.
Florida Spine Institute is home to some of the newest and most innovative treatments for back pain. These surgeons are trailblazers in their field, helping to fine-tune the development of back pain breakthroughs.
If we do not do these clinical trials, these procedures won't become available, and we'll continue to treat patients the way we've always treated patients. And there are better ways to treat them as we discover through these clinical trials. And that's why it's important to participate in these things and to be passionate about them. But you also have to be cautious in a sense. The clinical trial has to make sense, and there are certainly lots of steps that are taken before it becomes a human clinical trial to make sure that it's a safe clinical trial for the patient.
One new breakthrough procedure performed at Florida Spine Institute is redefining minimally invasive spine therapy.
The benefits of selective endoscopic discectomy are that we can treat large disc herniations through a small portal as an arthroscopic type procedure and do it as an outpatient procedure.
As new techniques for managing back pain develop, Florida Spine Institute will stay on the cutting edge of back pain treatment.
The importance of, and the future for Florida Spine is to continue to participate in advances in spine care so that patients receive the best possible spine care. And this will evolve into motion-sparing technologies. It will evolve into minimally invasive techniques. So this is what Florida Spine is all about, is trying to be involved in the practice of spine surgery so that it continues to progress and benefit patients and provide them appropriate care so they can get back to a functional lifestyle and participate with their families in activities that they like to do.
For more information, visit floridaspineinstitute.com.